We're live on YouTube.
Okay, pwede na po tayong magsimula. Magandang umaga sa lahat at salamat sa paghihintay. Ngayon po ang ikalawang webinar sa serye ng State of the Philippine Environment 2020. Ako po si Leon Dulce. Leon na lang po ang itawag niyo sa akin. Ako ang National Coordinator ng Kalikasan People's Network for the Environment. Isa sa mga co-organizers ng webinar series na ito, kasama ang Center for Environmental Concerns, ang Ibon Foundation, at ang Youth Advocates for Climate Action in the Philippines. Ito po ay isang official part ng Earth Day Network activities din, kaya maraming salamat po sa Earth Day Network for helping us promote this webinar. So sa simula po ay ilang paalala na muna tayo. All throughout our webinar ay papanatilihin po nating nakamute lahat ng mga kalahok na audience upang matiyak na minimal yung magiging pagkaputol ng ating pagtatalakay. Yung video po natin ay nakapin lang sa ating magiging lecturer sa umagang ito at sa magfa-facilitate ng discussion po natin. Ipapadaan po natin yung mga tanong natin as we think about our questions through the chat section of our Zoom conference room. At doon naman po sa mga nanonood sa YouTube Live, ay pwede po kayong magpaabot ng questions sa comment section naman ng YouTube. Mayroon po tayong secretariat na kakalap ng mga tanong na ito at susubukang i-consolidate yung mga magkakatema na tanong. Yung ating lecturer po ay magbibigay ng presentation for at the most full 1 hour. At the middle of the presentation ay magka-cut tayo para mag-entertain ng ilang initial questions. At the end of the lecture part ay bubuksan natin yung oportunidad na makapagtanong ang mga audience sa open forum. Sisimulan po ng ating facilitator yung question and answer portion at later on ay bibigyan ng opportunity ang 2 hanggang 3 audience na makapagtanong through our Zoom chat, through our Zoom conference room. The rest would be entertained as best as we can through the consolidated questions para kung yung mga magkakaparehong tanong, ipagsasama na po natin. Sa mga tanong po na hindi masasagot dun sa maikling oras na meron tayo, iipunin po ng secretariat itong mga questions at ipapaabot na lang natin sa ating tagapagsalita upang kanyang masagot at the time of his convenience. Also po, hinihikayat naming lahat na tuloy-tuloy tayong magtalakay ng ating mga matututunan, mga reflections, mga insights na makukuha natin sa lecture na ito sa inyong kanya-kanyang social media using the hashtag SPE20 at hashtag COVID-19PH. Ulit po, hashtag SPE2020 at hashtag COVID-19PH para meron din po tayong mahikayat na discussion sa Twitter, Facebook, Instagram. Sige po, yun po yung ating mga paalala. Nung unang talakayan po kasi namin noong April 18, nung Friday, inaral natin yung pagkakaugat ng COVID-19 sa pagkasira ng ating kalikasan bilang isang zoonotic disease o yung sakit na nagmumula sa mga hayop. Ngayon naman po ay susubukan nating tasahin ang naging tugon ng ating pamahalaan sa krisis ng pandemyang ito. Partikular sa kung natasa ba ng maagap ng ating gobyerno yung mga risk o yung mga bantang panganib at nabigyan ng angkop na paghahanda at pagtugon dito. Importante po ito para sa ating mga makakalikasan upang makita natin kung ano ang mga hamon na pinipresenta ng ating kasalukuyang sitwasyon at kung paano makakatulong ang ating mga partikular na kapasidad o kakayahan dito. So sa punto pong ito ay ipapakilala ko ang ating facilitator para sa webinar na ito na magbibigay ng proseso o ipapadalo yung proseso ng ating talakayan. Siya po ay isang manunulat at komentarista sa mga usaping politikal at kultural at nalathala ang kanyang mga obra sa iba't ibang mga publikasyon at pahayagan. Siya ay kasalukuyang guro ng Multimedia Arts sa College of St. Benilde School of Design and the Arts at siya po yung tagapagtatag ng PAG-ASA o People for Accountable Governance and Sustainable Action. Ito po ay isang formasyon na tumutugon sa mga kagyat na usapin ng COVID-19 crisis sa pamamagitan ng pagdadala ng ayuda sa mga vulnerableng komunidad at iba pang interbensyon. So, bigyan po natin ng taimtim na palakpak mula sa kanya-kanyang kwarto. Taimtim lang po kasi baka i-judge tayo ng ating mga kapitbahay ngayon. Palakpakan po natin si Katrina Stuart Santiago.
Magandang umaga sa ating lahat, no? I'm sure medyo maaga ito para sa karamihan sa atin na uh, na wala ng sense of time and day and who have thrown away our calendars because of this crisis. I am very glad to do this with you guys this morning. Also because I think one of the more important voices that we've needed to hear throughout this government and especially at this time of pandemic is our guest today. So I look forward to it as much as the rest of you. So let me introduce him. Dean Antonio Lavinia is a Filipino lawyer, educator, and environmental policy expert, a former Undersecretary of the Department of Environment and Natural Resources, Executive Director of Manila Observatory, and Dean of the Ateneo School of Government. He currently teaches law, governance, and philosophy in the Ateneo de Manila University, the University of the Philippines, De La Salle University, Xavier University, San Beda University, Polytechnic University of the Philippines, Lyceum of the Philippines University, Pamantasan ng Lungsod ng Maynila, Far Eastern University, and the Philippine Judicial Academy. In addition to these teaching responsibilities, Dean Lavinia is the director of the Energy Collaboratory of the Manila Observatory. Until June 2019, he was also the chair of the Partnership Council, Partnership for the Environmental Management of the Seas of East Asia. Likewise, he is chair of the Board of Trustees of Forest Foundation of the Philippines. And to add to that, I think he is one of the more critical voices that we have all depended on the past 4 years and especially the past 5 weeks of this lockdown. So to all of you who are here and listening to us on YouTube, Dean Tony Lavinia.
Thank you. Thank you, Katrina. Thank you, Leon. Maraming salamat sa lahat na nandito ngayon at nakikinig. I had actually looked forward to this. Hihila ko ng paumanhin, hindi ako gumawa ng PowerPoint. One was yung actually, it's funny but ngayon sa quarantine was busy dahil ang dami-daming demands for this kind of talks, this kind of inputs. But actually, more importantly, I didn't want to do a PowerPoint for this because I want this to be less about information. Dahil I'm sure lahat tayo may oras tayo magbasa, magtingin, marami na tayong information. I want this to be more to be about insights, about perspective. Mas gusto ko ito na maging thought-provoking rather than just dumping a lot of information again with you. No? This is part, as we know, of the Earth Day celebration. The Earth Week. I am actually dedicating my whole week to all my environmental work for this period. Right now, in fact, right after this, tatapusin ko siya, I'm actually writing an article, a column for my Eagle Eyes column in Manila Standard, entitled "The Most Meaningful Earth Day Ever," because it really is the most meaningful Earth Day ever. I mean, if ever may taon na napakahalaga ang ang ating pakikibaka para sa tao at para sa kalikasan, ito yung panahon na yon, no? Kasi nagiging malinaw, I guess from your previous webinar, kung bakit tayo nagkaganito. Diba? Kung bakit nagkaroon ng pandemic, ano yung physical causes niya, biological causes niya, ano yung papel ng human beings doon. Hindi ko na ulitin yun kasi that was your last webinar. But let's just be very clear about that, diba? This is not, diba, like climate change, which I will talk about a bit later to relate it to the pandemic. This is not a natural disaster. diba? And this is not a natural disaster. This is a human-made disaster, a disaster created by human activities, no? Essentially destroying our forests, destroying biological diversity, disrupting habitats, is the reason why, and it continues to happen all over the world. No? So mamaya babalikan ko yan because my last part would be about how to prevent future pandemics. What I will focus on for my presentation, I would call it my sharing rather than a lecture today, are three questions. The first is the government response, no? Dito sa pandemic, an overall response, ano yung tama, ano yung hindi tama, ano yung tulad sinabi ni Leon, nakapaghanda ba tayo dito? Agad sabihin natin hindi. Ngayon hindi tayo nakapaghanda, anong pwede natin gawin na mabilisang maging mas mabuti ang ating response, no? Ano naman yung dangers ng response? I-stress ko yan sa first part ng aking talk. Sa second part ng aking aking talk ay pag-uusapan ko yung very specific things related to the environment. Now, how the pandemic can exacerbate environmental problems, but how the pandemic can also give us opportunities, no, to actually do better by the environment. And then after that, we will have that break that Leon talked about, where I think Katrina can facilitate the discussion and the question and answer. And then I will end with the future. Ano yung pwede nating asahan sa hinaharap, ano again yung mga threats na kailangan natin paghandaan, for ano rin yung opportunities na pwede natin i-maximize. Can we dream of another world, a better world after the pandemic? So first, about the government response. Sabi ko, of course, hindi sila naghanda. No? In spite of all the studies that have been done, all the assessments that have been done, di ba? No government really, and that includes the Philippines, have prepared well for pandemics, for this pandemic. Sa totoo lang, I had actually worked on this issue year 2000 as an academic. I mean, there was a United Nations Millennium Assessment in 2000 at the millennium. So we started doing it in 1999, finished it in 2000 to give a state of ecosystems. I mean, and in essence, the conclusion was ecosystems are in very bad shape. We are destroying ecosystems, all ecosystems without exception. Forest, agriculture, marine, coastal, biodiversity, all of that we were not doing well in all of that. And in relation to that, nag-build kami yung I was part of the team in that assessment, which was a United Nations assessment, World Bank, ang daming groups involved. My own organization at the time was the World Resources Institute. Yung grupo namin, I was assigned to do the review for all the scenarios, di ba? And that was clear. Pandemic, biologists have told us again and again that this was coming and this will get worse. We will have many of these if we continue the way that we were continuing to doing. And in the second place, kahit na, even then, no, it's like climate change also, kahit na pigilan natin, subukan nating maging mas mabuti, we have already unleashed, di ba? Some of it already. So pwede na siyang mangyari and we have to prepare for it. And we can prepare for it in different ways. No, I mean, and the best way really was to have prepared for it from a community, inclusive community point of view, di ba? Yung ito yung tinatawag na problema na whole of nation approach, whole of world approach na kailangan to respond properly, lahat tayo ay may consensus kung anong kailangan gawin. Hindi tayo nag-aaway-away, malinaw kung anong dapat gawin, anong papel ng gobyerno, anong papel ng private sector, anong papel ng mga ordinary citizens, anong papel ng local governments. No? But I guess those type of warnings were were ignored, were not taken, meron ding specific health measures na na-identify na even at that time. Now in the Philippines, we also had in 2010, as you know, a law called the National Disaster Risk Reduction Management Act. No? I mean, and nakafocus siya syempre sa climate-related disasters and to earthquakes, geological events like earthquakes and landslides. But pandemic is actually part of that, diba? Part of things that you prepare for. And we should have learned na nangyayari siya. I mean, yesterday, ito endorse ko isang movie ni Gil Portes at ginanapan ni Alessandra De Rossi, Homecoming, tungkol sa SARS. No? That's a very good movie to watch, especially if you're OFW, if you're an OFW family, kasi that anticipates what will happen in the next 2 years. Pag nagsiuwian yung ating mga OFW, kung magsisiuwian sila, di ba? Maka-quarantine sila, kung may dala silang COVID-19, madi-discriminate upon sila at lahat. Yung tungkol lang sa SARS, very, very small lang naman yun compared to what we're seeing now. SARS never got to become a pandemic of the proportion that we now have kasi na-controlled siya, no? And then nag-disappear siya. But warning na yun sa atin na pwedeng mangyari, di ba? So dapat ready rin yung ating Department of Health for that. I really, as much as I respect si Secretary Duque, I don't think it is correct to say na diba, we couldn't anticipate something like this, diba? Experts, including in the DOH or people working with the DOH, have always anticipated na this would happen. Anyway, nandun na yun. Actually sa akin, hindi ko masyadong ididiin na palpak yung gobyerno natin, na hindi siya naghanda, na mali yung kanyang mga first moves, simply because 95% of the governments of the world also perform that way. Talagang konti lang talaga yung mga gobyerno na so far, in fact, kahit na yung, so ang nakita ko nga, dalawa lang talaga ang effective. South Korea, naging effective yung South Korea, at yung New Zealand. Yung South Korea is the example of yung early testing, massive testing, contact tracing, and then because of that, dahil napaka-sophisticated nila, napakalaki ng kanilang social consensus, they were able to limit infections. So, and importante ito, which is not gonna be hirap sa atin, heterogeneous yung South Korea. They're mainly basically Korean, so konti lang yung foreigners sa Korea. New Zealand naman, very effective. Early lockdown. And then they closed down their airports, they closed down, and they locked down early. Hanggang ngayon naka-lockdown sila, but they're starting to easing up. Those are really the only two countries that I say are successful. Kahit Singapore, hindi siya successful. No? Kasi yung Singapore at first successful, but Singapore forgot one thing. One was yung nagsisibalikan na Singaporeans who brought COVID back home, but more importantly, that they have a very big migrant population na living in very yung malapit na mga densely populated so nakita natin nagsa-surge ulit sa Singapore. So meron ng pagkakamali yung Singapore. At Taiwan pala is the third na effective. Taiwan is like Korea, heterogeneous. It's also like New Zealand, it's an island. May lesson dyan kasi may lesson dyan sa atin dahil although we are one country, we are a country of many islands. Okay? So many of the islands that we actually have that are heterogeneous, walang foreigners, walang tourists, can actually lock down and eliminate and suppress the virus. Now, having said that, so I don't want to make a big deal about yung kapalpakan ng government natin. Alam na natin yon na we should have closed down from China 2 weeks earlier, 3 weeks earlier, di ba? But I won't that kasi nga karamihan ng mga gobyerno sa mundo ay nagkamali naman ng ganon, no? I think yung overall response of quarantine and right now we're called an enhanced community quarantine. Pinapag-usapan na may strictly enhanced pa. Dati yung
first 2 days community quarantine lang. But in essence, the quarantine response, which is a social distancing response, is the right first response, no, to a pandemic. Scientifically, I haven't seen really a strong argument na otherwise, di ba? I think the countries that went the other way at first, sandali lang, like England na, sige, ispa-spread na muna natin, quickly change when they saw how many deaths it would cause. Sweden right now, parang ganun yung Sweden, pero there's also a surge in deaths in Sweden among the aged population. So I don't think successful yung Sweden. So generally, I would say almost all the scientists and the science I've seen here, social distancing is the right approach. How to get there, iba-iba. Yung pinaka-strict is bawal lumabas at all sa mga bahay, even sa mga bahay mo sa village mo, bawal bawal 'yon. Yung iba mas voluntary, yung ibig sabihin guidelines lang siya. People are asked to stay 6 feet from each other. People are asked to not to gather in big crowds, etc., di ba? So ang tingin ko lang yung quarantine has always been about how strict it will be, how voluntary it should be, no? My critique sa Philippine approach to this is that hindi binigyan consideration yung actual reality ng maraming mga Pilipino, di ba? Lalo na ng mga mahihirap, lalo na yung urban poor, in densely populated areas. Hindi binigyan, sa tingin ko, kinonsider or na prioritize yung pangangailangan ng mahihirap for income, for food, for even for the basic health needs, no? So what we have done is, instead of being successful sa social distancing, we have put things in place na will actually exacerbate the problem, di ba? Nakita na natin yan sa mga merkado, sa mga groceries, that people, because nilimit yung oras, people are are congregating, mahaba ang mga pila at lahat, di ba? In fact, dapat nga siguro 24 hours yung mga or at least 12, 15 hours yung bukas yung mga yan para, and then bibigyan ng quota, di ba? Even by appointment kung kailangan, then you would have a more rational thing to do. Yung panghuhuli, arresting people, that's yung sabi ko, that's the most the most contradictory thing that you can do. The policeman being out there arresting people means na they will also contract, and if they arrest people, they put them in, di ba, nilalagay nila sa mga sasakyan, nilalagay nila sa mga detention centers, di mas lalong mas lalong dadami ang pag-spread ng infection, di ba? Isa sa early advocacy ko, I also want to mention this because it's very important for me, no? And we're reaching a critical point. Yung release ng prisoners, political prisoners, low-risk prisoners from detention centers, even convicted prisoners na mababa ang mga crime, hindi violent yung mga crimes, no? Because any scientist will tell you, di ba, that prisons are a hub of infectious diseases, di ba? And if you keep them there together, they will infect each other. Isa lang, and wala kang guarantee. Bakit? May guards, may staff, di ba? They all go out asymptomatic. Kung asymptomatic sila, they come in. They spread it to one prisoner, it spreads to everyone, it spreads to the guards, di ba? So ganun din yun sa mga police. They arrest people, it spreads to them. Ganun din sa military, if they come in, may nakita akong that's one thing I will point out later on. The militaristic approach here is not only wrong from a rights point of view, it's not only ineffective, but it will actually lead to more deaths of the pandemic, more infection of the pandemic, di ba? Because the very nature of a militaristic approach is you bring soldiers together, they go to one place, they round up people, di ba? Ganun ang gagawin nila. Then magkakasakit sila, mamamatay sila lahat. Sa China, hindi ko nabanggit yung China kanina sa response. Hindi ko sasabihin China has been successful because maraming namatay at the truth is that hindi lang na-contain kaya all of us are suffering. Let's be very clear about that. That if China succeeded in January, we will not be here today. Diba? But sa China, nag-succeed sila eventually after 3 months, at least of limiting the spread, because they sent soldiers in, but these soldiers, battalions of soldiers in, are actually all doctors, nurses, trained in chemical and biological warfare. So yung mga sundalo sa China na nag-take over sa Wuhan, lahat yan sila naka-PPE. Tayo nga, we don't even have PPEs enough for our doctors and our nurses. Bibigyan mo pa yung mga sundalo at police. So sa akin, the only way successful yung militaristic approach, yung police approach from a health point of view, if lahat ng police at lahat ng military naka-PPE sila. Diba? But we don't have that PPE at all. Diba? Which brings me to a second critique to the government response. No? Yung what we have seen kasi is dapat kasi yung when you do a quarantine, hindi yan siya, kasi sabi ko, it's the necessary first response. For first response lang siya, unang pagtugon lang siya. That gives you time kasi to do the other things. And most important dyan, to do the other things, is to beef up your healthcare system. Okay? So totoo lang, I would say the healthcare system was getting better, but it was not in good shape even before this. Alam naman natin yan, na lalo na mahihirap, doesn't get the best healthcare services as they need, as citizens need. Mas may konting pera na because of yung different laws on the sin taxes, etc. But kulang pa rin yung hospitals, kulang ICUs, kulang yung equipment, di ba? So we did not only have stock up piles ready for incidents like this, but we have not used the time very well. After that, hanggang ngayon, people are, nurses and doctors are dying. Out of our X number of deaths, 300 to 400 na yung or 700 na ata, 700 na yung doctors and nurses. 300, something like that. Big number. Maybe I'm wrong about the numbers right now. I'm thinking about yung cases. No? Sabi na 12% daw of cases or 12% of them. But malaking percentage ng ating cases at deaths are our So kasi yung una-una mo kailangan gawin, you have to protect your healthcare workers kasi sila yung frontliners mo, di ba? And so I think may pagkukulang din doon. I think hopefully things are getting better. They say may PPEs daw, 1 billion ata worth of PPEs they bought from China, and hopefully mag-ease na yan in the next few weeks. I think magkakaproblema ng distribution. One of the problems have always been, in my view, yung attempt ng government to centralize everything. The other day, I wrote a column in the news. One of my multimedia news sites criticizing the government for being too bureaucratic, the national government for being too bureaucratic, diba? And therefore stifling innovation. May dalawa kasi silang issue na na mali, no? Yung sa tingin ko mali, napaka-bureaucratic. One, yung kailangan lahat ng donations to government hospitals dadaan sa OCD. That's crazy. Di ba? That's crazy. If I live near a hospital and I have money or I have equipment that I want to give to the hospital, ba't pa ako pupunta all the way to Aguinaldo to OCD? Why don't I just give it directly to the hospital? Di ba? And OCD doesn't have a presence all over the country. So clearly, bureaucratically, that's wrong. And thankfully, hindi yan sinusunod. Parang nobody really follows that. From what I've seen, parang people just go directly to hospitals. Hospitals accept from whoever give it to them, di ba? Pangalawa, yung last week, although bukang nag-backtrack naman sila, yung DSWD nagbanta na huwag kayong mag-solicit until you have registered with us, di ba? Again, how crazy is that, di ba? In a situation na kailangan yung whole of nation, whole of society yung approach, di ba? The other day, yesterday ba yun, may mga hinuli. Actually, yung isang former anak Pawis representative, di ba? Hinuli siya, kasama niya mga kasama niya na nagbibigay sila ng goods, di ba? Ng relief goods dun sa isang barangay, di ba? I mean, again, kasi wala daw silang permit. You shouldn't do that, di ba? You should allow people in a whole of society approach. You have to allow people to be innovative, to be flexible. Di ba nakita natin yan kay Vico Soto? I think Vico Soto is a really good example of yung flexible on the ground, di ba? Nakita niya kung yung mga tao kailangan may bumili, yung mga health workers kailangan magbiyahe, di ba? Dapat payagan mo yung tricycle. Otherwise, everyone will walk, di ba? And you just impose social distancing dun sa mga tricycle. Pero sabi ng national government, di pwede. Although it turned out na pinayagan nila si Sara Duterte dun sa Davao because it makes sense, no? It makes sense. So yun yung pangalawang critique ko sa government approach. Huwag naman masyadong bureaucratic. Allow innovation. For me, the top performer in this crisis so far is VP Robredo, no? VP Robredo, with very little money, raised money through private sources, through an NGO, kaya natin, and that just went on delivering very specific things, di ba? Ano yung dineliver? PPE, transportation, dorm facilities for very, very practical, very focused, very, very effective from what we have gathered, more effective than any other national government agency have done. Okay? Now, let me go to a third comment, critique. No, I mean itong escalation of the militaristic approach. No? I think it's very important to point that out, diba? Aside from a violation of rights, which is very important, digress lang ako ng konti. Bakit mahalaga ang right to information, ang freedom of expression, ang right to assembly even, but in an online way, in a safe way, hindi yung rally na marami tayong magsama-sama, but the right to voice our opinion. Now, why is it very important? Because information is very critical at this time. Exchange of ideas is very critical at this time, di ba? Even scientists do not hold the monopoly of truth. The government does not hold the monopoly of information. It needs information from other sources. And of course, it doesn't hold the monopoly of what is the right thing to do. Yung nabanggit ko lang yung dalawang kalokohan, di ba? Yung centralizing donations and requiring solicitations to be registered, di ba? If you stop the flow of information from other sources, if you prevent people from criticizing the government or responses, then we will have to settle with bad information and bad decisions, di ba? That's why napakahalaga yung karapatan sa panahon na ito. So a militaristic approach that is targeted at people, di ba, at people's right to inform each other, right to criticize each other, is very, very bad, no, for dealing with the pandemic. we will end up the pandemic worse, the responses worse if we stifle that. But also biologically, a militaristic approach is a bad approach. It's bad for the AFP. That's why, if you actually hate the AFP, you want them to do this. Diba? I don't hate the AFP. I actually have many students who are in the AFP. Every year I teach generals, colonels, majors, even second lieutenants sometimes, and also in the PNP. I teach them in various schools that I teach either as lawyers or in the School of Government of Ateneo. So, and they're very, very good. I have very, at least sa mga aking mga estudyante ay pro-human rights palagi at democratic, very democratic. So I don't take the AFP at all. And because of that, their leaders should know na a militaristic approach will destroy them physically. Diba? It will spread among its ranks. They sleep together. They should not even be sleeping together right now. Diba? Kahit na yung mga 6 feet, okay lang yung 6 feet if once in a while. But 6 feet na the whole night, that's actually not very safe, if you ask me. Diba? So, and then you send them out, diba? You send them out, manghuli ka ng mga tao na wala kang alam kung yung mga tao na yun may infection or not. That is very bad physically for the people, for the AFP, for all of us, because they also mingle with us. No? So for me, a militaristic approach is not only bad from a rights point of view, which is disastrous from the response to pandemic, it's also bad from a physical point of view because people will die, soldiers will die, people that they arrest will die, their families, both of soldiers and will also die because of this, di ba? So kailangan tingnan ng mabuti yung approach na yon, di ba? And then I will just say one last critique of the response, no, which is yung pag-marginalize ng local governments. There is constant threatening of local governments na mali kayo, ninyo dapat ginagawa yan at lahat-lahat ng mga ganyan. That is not good. That is not good. I mean, alam natin yan, basic, nagtuturo ako ng disaster management. I'm always proud to claim si Vico Soto was my student on that subject. I mean, and actually many LGUs, many LGUs and many national officials have been students of mine, including actually military officials in that subjects at the School of Government. And basic yun, the frontliner in a disaster is the local government. So your goal should be to empower local governments, to give them money, to give them support, to give them technical support. Yun ang dapat mong gawin in a disaster. You don't second guess them as we keep doing that. Next to VP Soto, I would say the best performers in this response are local governments. I mean, let me just cite, of course, I cited Vico, yun ang pinaka alam, but Marcy Chodoro of Marikina, Rex Valenzuela, sila yung nauna ngayon sa testing, di ba? They have very good testing already that set up. Alam naman natin yan, related yan sa first critique ko na yung nature ng quarantine natin. Yung quarantine buys you time, it buys you time to put into place testing. You cannot go back to normal unless you have good testing capacity, di ba? Yung massive testing. I'm not gonna say mass universal testing, but massive testing. So you actually know that it's safe to go around because not too many people are actually going around sick, no? But the local governments, nauna yung local governments. Yung regional approach to this, I would have to give credit to Governor Remulla taking an effort to get Laguna, Cavite, Batangas to have a regional approach to this. No? I mean, in contrast, sa Bukidnon, for example, Governor Subiro, and I know he comes from a good heart, no, good intentions to keep Bukidnon safe. But Bukidnon is landlocked, diba? It needs all the provinces around it. It doesn't help that it impedes yung kanyang policy, impeded transport of people and goods back and forth to Bukidnon. So I think in terms of the government response, I think that is enough input enough to provoke discussion. let me just move very quickly naman sa environmental aspects, the environmental response. It's unfortunate for me kasi um, this is actually an opportunity to do right by the environment, di ba? I actually don't see the DNR very active in the response. I mean, and I think they have to be more aggressive. No? Instead, we have them doing things like allowing the mining, the ship, di ba, from China to dock in Omonan Island para kumuha ng mga minerals. How crazy is that, di ba? At the time when we are trying to prevent viruses from an island, lalo na isang crewman lang, di ba, na Chinese, ang alam ko Chinese at Myanmarese daw yung crewman dun sa Chinese ship na yun. Isang person lang na yun um, makapag-infect ng isang Coast Guard or isang DENR o isang whatever, di ba? The whole island is doomed. It's an island, di ba? So was this the time actually to be strict about your environmental laws, di ba? So that you do not exacerbate the problem of COVID-19, which is an environmentally caused problem in the first place, di ba? Now, of course, there are good aspects, di ba? Yung what they call silver lining. I don't call it silver lining kasi it's too costly to have this effect, di ba? And we could have done it naman without the deaths, without the sickness. Yung clean air natin, air is much cleaner kasi syempre sa Metro Manila walang zero mobile pollution from mobile sources, walang mga sasakyan, di ba? Walang economic activity masyado, di ba? So that is I mean the clean air is of course good. I don't know if you notice, but kung lalabas kayo ngayon sa gabi, kung wala masyadong ulap, suddenly yung Metro Manila para na rin siyang, hindi ko naman exaggerated naman sabihin Camiguin Island kasi may ilaw so hindi nakikita lahat. Pero ang daming bituin, malinaw na Manilaw yung buwan. Very clear na our measurements for pollution have gone down. Because of that, mamaya sa next part pag-usapan natin yung how do we keep it that way even if we restart, no? Kasi that's a good effect of the pandemic. Waste is a big issue, no? Kasi maraming toxic waste na syempre sa mga hospitals, di ba, dapat inaasikaso yan, sa mga bahay natin. I suppose maraming mga household waste na nag-accumulate kasi nasa mga bahay tayo. Hindi masyado nakakalabas siguro yung mga di ba, yung mga garbage collectors. So this is a time for the DENR to be actually very aggressive about these things and doing these things in a safe way, no? Most of all, siguro, I would say that since unfortunately the pandemic causes a lot of death, causes a lot of suffering, of sickness, the DNR might want to be strict with activities na environmental in nature that actually can cause even more death, di ba? Then so I would say, for example, kailangan natin maging mas stricto sa industries like mining, like coal power, di ba? That can cause a lot of public health issues, no? So I think that's for now. Let me stay there, I mean, and answer questions kung meron na at this point.
Hi, thank you so much, Sir Tony. I think one of the things that resonates for many of us is yun nga, yung the fact that there seems to be there's an ECQ, yes, but it seems to be implemented very differently across social classes. So kung may kotse ka halimbawa, you can actually pass through many of the checkpoints, 'di ba? Nakakalabas ka ng matiwasay within the curfew, beyond the curfew hours. And then ang linaw na even now that they're talking about extending the lockdown and even strengthening it to the point of showing massive military movements in residential areas. Ang linaw din na parang ang pinupuntirya talaga are impoverished communities. So really the question is, while you say that you think as a first response the ECQ was important, how do we balance it at this point in terms, given the fact that in the 5 weeks we've seen how dire the situation is in these communities, but also how violent it has become for many Filipinos?
Okay. That's a good point. I mean, I want to stress that also. Yung from the very beginning, yung unequal and unjust distribution, di ba, of the burdens of the ECQ on the poor, particularly on the urban poor. And so one other critic I have of the kind of ECQ as we did was the government itself did not prioritize making sure that the poor could do this as least burdensome as possible. Na parang pinabayaan na lang nila yung local government, yung private sector, kayo na ang bahala. And moving forward, yan siguro ang pinaka-crucial na na kailangan gawin. I have to say lang one thing, no? Hindi rin siya tama na sabihin na, di ba yung sinasabi ni minsan na mamatay na lang ako sa gutom, sa COVID kaysa mamatay sa gutom, kasi sa COVID hindi naman sure, sa gutom sure na yon, di ba? Hindi ka dapat mamatay sa gutom, hindi ka rin dapat mamatay sa COVID, di ba? That's the right response. Ba hindi na okay lang mamatay sa COVID kasi mahirap ako, mas mabuti makakain ako, makatrabaho ako. Okay? That means the burden is on the government to make this happen, di ba? To feed the people, to give them income at this time. The Bayanihan Act did some of that, but very minimal. And as far as I know, maraming hindi naka-benefit doon sa both workers and the poor. Na wag na lang yung middle class necessarily. Again, makita mo ang pinaka innovative doon si Vico Soto, di ba? Universal yung kanyang pagbigay, but is asking the rich. Sorry. Hello. Sorry.
Yes, you're back.
Yeah. Nawawala yung screen. Dali lang. Anyway, he's asking the sa chat pala ako kaya. He's asking the rich to waive their Why is that good na universal? Even if you ask the rich to waive. Well, kasi wala ka ng means test, di ba? Ang problema kasi, alam na natin lahat yan, yung mga, halimbawa sa socialized tuition fee noon sa UP, di ba? Pag nagkaroon ka ng means test, unfortunately sa Pilipinas, walang effective, sufficient, adequate means test to be sure na mahirap talaga ito, mayaman ito, di ba? Things like may cellphone ka ba, may TV ka ba, those are meaningless. Because many poor people have those things, but it doesn't mean they are rich, di ba? And that they do not need help.
So something like a universal is actually good to be able to reach the to be able to reach everyone, no? So I think that should be the priority, and unless ma-solve yan, thinking of extending the ECQ for a longer period of time, and in fact making it even stricter, di ba, is a recipe for disaster, in my view. That is why when we go to the responses later, to the future later on, sa akin talaga ang massive na kailangan gawin, na we have to really catch up with, which we don't have, di ba, too much, is yung social capital, di ba, to do these things, di ba, na kailangan gawin without having to resort to militaristic approach, kasi the militaristic approach might be simplistic but it will not be effective.
I think also in direct relation to that is the question of whether or not you feel that this community quarantine actually flattened the curve, or was that even the point? Kasi parang in your discussion, you didn't even mention flattening the curve. You were just really talking about how the ECQ was really a first response of many governments in relation to pursuing a social distancing exercise for everyone. But we haven't talked about whether it flattens the curve in terms of the numbers, and maybe in relation to that, in terms of the number of positive cases, and maybe in relation to that, the question of mass testing. Do you think it's sufficient? Because the only way we have a sense of whether the curve is flattened is if we have enough people tested.
Well, that's why I didn't mention it, because
Mhm.
I don't think that we have the baseline,
Mhm.
and still have the baseline to be able to say na the curve has been flattened. In the universe, di ba, of numbers, within the parameters of numbers that they have, nag-flatten na tayo ng curve kasi it's just about doubling, di ba? Hindi na siya nagdo-double every 2 or 3 days, nagdo-double na siya every 4 to 5 days, no? So from that point of view, they say that they have flattened the curve. But I think we would really only know that. Pero goal nila yon, ha? That was really their goal at the beginning. At the beginning kasi, very simple lang eh. At the beginning kasi, ang theory dito that all the cases will come from abroad. Diba? From that point of view kasi, and the first cases were like that, diba? That's why they were kind of proud na, konti lang tayo yung cases natin, diba? Konti lang cases natin. Hindi masyadong marami. And they were all from abroad, diba? Until local transmission began, no? So, yes, that's why massive testing is important. And I guess walang choice but to do it localized. Sa Manila, yung mga cities already doing that. But kailangan kasi sa Metro Manila, buong Metro Manila, all the cities should do that. Because, di ba, wala naman tayong borders between us. Ako, I want to start with the islands. Diba? Yung islands natin can actually, the big enough islands na kailangan ng testing, they can do that massive testing in those islands and protect those islands for a while, di ba? Ganun din yung the smaller islands, kung wala silang kaso ever, all that they have to do is to limit muna people from outside, di ba? But which brings you to one of the questions in the future. What does the future going to look like, diba? Even when you lift the ECQ, you cannot like have tourism back as before, diba? Because the right step is every time may papasok sa bayan natin or papasok sa isang isla natin, mag-quarantine muna, diba? For the required number of days, 14 days. Yeah. Sinong gusto magturista na pagpasok mo 14 days, diba? Hindi ka makakalabas, di ba? At all. At dun ka lang sa kwarto mo or dun sa wherever they will quarantine you. But that's what you have to do for at least the next 2 years hanggang may vaccine, di ba? Alam mo, kahit yung may vaccine tayo in 1 year or
18 months, it will take another 1 year to roll that out, diba? Especially in the Philippines, especially for the poor. So yes, I think testing is important, because we have, especially testing also of asymptomatic, di ba? Kasi dahil maraming asymptomatic that can spread the infection also. Importante yung medyo siguro random testing that is scientifically that will give you the number. In fact, naisip ko originally, in terms of symptomatic, you can actually do quick surveys nationally, di ba? To just know, gusto mo malaman ano yung database mo nationally, since statistically, di ba, may methods naman of doing that, you can actually just ask people sino may sipon, sino may ubo, sino may, di ba? May mga symptoms na most likely COVID, di ba? Have some kind of measurement that if you have 3 out of 4 or 3 out of 5, di ba, you're presumed to be COVID from a data point of view, di ba? And then you can actually have a snapshot, di ba? It can be a massive number instead of usually ang SWS at Pulse, they only do 1,200 respondents. So you can have like 10,000 respondents. You can contract both Pulse and SWS. At least you can go get a picture of the symptomatic, di ba? In 1 week. In 1 week, ito yung mga Pilipino na nagsabi percentage-wise na nagsabi na may ano sila. That can give you a general idea, no, ng but still it's not physically from a clinical point of view, it doesn't help. No? May difference kasi but from a policy point of view, it helps at last in terms of telling you na ito yung symptomatic, di ba? Na potentially COVID sila. No? Alam ko sa hospitals now, if you die, they kind of consider you COVID. Even if you're not in the numbers, di ba? And they treat you always as COVID na kasi as precaution until they're really sure na hindi ka COVID, then that's when they won't treat you as COVID. So kahit na you come in as a heart or whatever, ganun nilang nila. But testing is very important to be able to flatten that curve. Sa akin lang yung one it's not a silver lining, but one interesting positive thing lang here. And I don't know if dahil yan sa ating health system, di ba, na the poor actually do not get into the system, but we don't have our hospitals as deluge as in the thousands, di ba? I think in the hundreds or in the dozens. Kaya when I look at the data, yung karamihan ng mga hospital na private, puno na sila ng COVID kasi konti lang naman talaga yung capacity nila for those patients, di ba? If I'm not mistaken, yung PG8 hindi pa nga siya puno, di ba? And then we've set up facilities now na for larger quarantines of confirmed cases and sick people. So that's good naman na set up yon. But I will not make a claim na na-flatten natin ang curve except from the point of view of that small set of numbers that we have.
I think you actually touch on two things, no? Yung on the one hand, there really isn't enough information for us to navigate this crisis. Parang we're not really clear. We don't have numbers. We don't quite trust what the government machinery is putting out in terms of information. And while we all have naman access to information, at least those of us who are privileged enough to have the internet, parang we're all also grappling with the situation on an individual basis, which is part of why we have all this anxiety as well. No, it adds to the anxiety of a crisis like this one. So siguro, sir, to lead you then to the next part where you talk about the future, I'll consolidate then a couple of comments and questions from the ones who are part of this webinar. One of the things that we're getting are questions about policy changes in relation to the environment. And I think policy is already something that you've started talking about and which will be part of your second part naman. So on the one hand, the notion of in the future, what kind of future are we looking at given this virus? maybe immediate future, we're all being threatened with a martial law declaration tonight. So maybe let's talk muna about the immediate future and then the future, which is what you're also already talking about anyway. But also a real focus on what we can do better in terms of the environment, given the premise that this pandemic has been brought about precisely by environmental destruction. What can we do better when we're all past this part of the process?
Okay. Sige, let me proceed then. Sa immediate, diba? Yung urgent is to make sure to push back on the government's threats, diba? And ako, I push back from a very practical point of view, diba? Yung just pointing out how absurd those policies would be, diba? If they go to it, that it will actually not lead to the solution, to the outcome na gusto nila, like declaring martial law or a military. Hindi mo pwede mag-declare ng martial law kasi walang invasion or rebellion. In fact, totoosin, you cannot even call out the military for this because wala namang violence, diba? I wouldn't consider people violating social distance guidance, social distance guidelines or laws as of public order, di ba? I think that there are better ways to solve that, di ba? More education, giving them what they need. Why do they go out, di ba? So I think we have to push back on that. So far, the good news is we have had a good record, di ba? The citizenry has had a good record of pushing back on what the government floats or decides to do. And then pag nakita naman nila na tama naman tayo, they seem to minsan lang matagal. Ako, I will tell you, sooner, hopefully not later, we will have the release of prisoners. No? Sure yan. Kasi the logic is impeccable from the society point of view, di ba? Hindi lang from the prisoner's point of view, but from the society point of view. So, I'm not very scared about that. I think we have to just push back. No? There are people naman I've seen in the IATF, the task force, that are reasonable. And I actually like very much si Secretary Carlo Nograles, no? Because she is very, very rational in the way he explains things, no? And he makes a lot of sense. Even sa scientific aspects, one of the most controversial figures, Dr. Saldana. But if you look at Dr. Saldana and look at all his exchanges, he sometimes does consider the views of others. So pahirapan lang minsan, but he's a colleague from UP. He's has strong opinions, and I actually am okay with that as long as other strong opinions are also respected. Ang real problem short term is how to reopen the economy. I mean, how to make people go back to work, for those who have work to go back to, and for those who do not have work to go back to, how to make sure that they got income and they have yun ang pinakamahalaga, no? Kasi mga mahihirap, kahit na middle class, but middle class that are di ba, yung dependent on wages, or small businessman dependent on daily sales, di ba? How long can they last if they do this, di ba? And so short term, that's why importante sa mga LGUs, importante na pinaprioritize nila yung testing. Kasi that's the only thing that can give them confidence. Pag nasabi nila, nasa lugar nila, wala nang COVID, o na-eliminate na yung COVID, o lahat na may COVID ay naka-quarantine na, and then nakaput na sila ng system in place to prevent people from coming in and out, then they can reopen, at least in their places. It will be problematic in Metro Manila because people live in one city and work in another city and commute, di ba? The return of public transportation is very important kasi that allows people to work, that allows people to visit each other, to visit relatives, di ba? Allows people to conduct their business. Pero kailangan i-configure mo yung trains, yung stations, na magkaroon ka pa rin ng social distancing sa pagpasok doon. So sana ginagamit yung panahon na ito ng MRT, LRT, ng buses na i-configure nila yung mga buses nila, yung mga cars nila na fewer people, di ba, will have to come in. Kaya kailangan mas staggered yung hours at lahat, no? This is not going to be as short term as we would like it to be. Diba? In other words, if we reopen, I suspect later rather than earlier in May, some workers can go back to work, some businesses can reoperate again. Marami pa ring rules sa social distancing. Marami pa ring rules about big gatherings, diba? So schools are going to be challenging kasi by their nature, massive numbers of people yon that congregate with each other from everywhere. Churches will have to find some way to operate with less number of people, so staggered din siguro siya ang services to do it that way, to do it safely. I don't think malls, concerts, sports events can happen for the next year or two, di ba? Tourism, I don't think tourism, di ba, will bounce back for the next year or two. So in other words, the new normal will be a longer new normal, and some of it could become permanent, in my view. And the reason why it can become permanent is because this will not be our last pandemic. Let's be clear about that, diba? Unless we act properly. Yan yung about environment. Unless we act properly. But business as usual, in other words, kung ang new normal natin includes mining, logging, pollution, coal power plant, I mean, it includes all of those things which led to pandemics. Diba? Yung pinag-usapan niyo last time, yung how it's caused by biological, zoological causes, diba, etc. But also, I would say, also by environmental causes, diba? Disruption of habitats. And disruption of habitats come not only from extractive industry, logging, mining, but also from climate change. Right now, in fact, I think it's still ongoing. The whole of the Amazon is essentially being deforested and being devastated. Diba? There's lots of viruses that will come out from there and jump first to big Brazilian cities and spread all over. In other words, yung new normal natin might actually be the permanent normal. Or every few years, we go back to this new normal. So we might as well, if this is the new normal, we might as well look at the positive aspects of it and build on it and do it better. Ako sa simple world ko na pagtuturo, di ba? Because I've been teaching online, I've been posting online, I have been doing video lectures, doing webinars like this, di ba? There's so much possibility not to meet my students on a regular basis as I used to face-to-face, di ba? I honestly think that most of the courses I teach, I can teach it with 2 or 3 face-to-face meetings and 2 months of online interaction. Pero actually, mas matrabaho sa akin, to be honest. But I actually think na for the current generation of students, it's actually good. You know why? the one thing I've always obsessed with as a teacher is makapasok ako sa online life ng mga estudyante ko. Kasi alam ko online sila all the time, di ba? If my teaching is going to be mainly online for those that can do that, di ba? Then I get into their life, di ba? On a daily, hourly basis, di ba? And then they will learn more, in my view. Now, ang problema dyan is it's so unequal. Again, di ba? Some schools, ako, i-praise ko Ateneo de Davao is the first to do it, di ba? What I know in Ateneo de Davao, kasi may summer class na sila, hindi na sila naabutan ng pag-close ng klase kasi tapos ng klase when COVID started. But naabutan sila ng there was a debate on whether they have online class for summer or not. But then they made a commitment that every student will get an equipment and a Wi-Fi access, di ba? Now, in reality, how that happens, how they do that, what the financial, I don't actually know. But yun ang kailangan mong gawin. My least of my worry is the college, university. Kasi I teach in many universities. You will find it interesting, for example, although my explanation dyan na in all my online classes, online interactions, the ones that have interacted with me the most are the students from Xavier University, Cagayan de Oro yun. And that's maybe because hindi man grabe yung COVID, so they're not very worried about themselves, di ba? And my students in PUP, no? While my students in, di ba, upper middle class schools, parang napansin ko are not as engaged. They are engaged but not as engaged. No? So this is just interesting. But ang worry ko dyan yung basic ed, di ba? Kasi yung basic ed natin, alam mo, they cannot, there's no ability to go online at all, di ba? So DepEd will have public basic ed. Yung private basic ed, they can also go online and do a lot of things online, di ba? But yung basic public ed, we have a problem there. Now, they can also do social distancing, di ba? Kasi the classrooms already gamit na yan from 7 to 6, di ba? In the evening with different shifts of students, di ba? So DepEd, I'm sure Secretary Brones is racking her brains and her teams racking their brains about this. We'll have to find a way to move forward, di ba? Is homeschooling optional for kasi it will not be normal for education for the next 2 years. But ang idea doon is that you can actually then change your system this early and make it better for the future already. And so I've always thought that our education system has to be reformed anyway, in the way we deliver our education. Ngayon, parang abruptly, they have to do what would usually take 10, 20 years for them to do, no? Then of course you have work, di ba? You have labor, and you have the basic sectors, farmers, fishermen, lahat yan sila. Kailangan yan may pathway. It is incredible to me na yesterday lang natin na kita yung order to the departments, all the departments finally, to develop their plans, di ba? Because they have to change all their programs. Hindi na pwede yung dating programs, di ba? They cannot deliver the same services as before without changing that. Which brings me to environment. Now, what needs to be changed in the environment? As I said, actually, the environment stands to benefit the most from the changes that have to be done. Kaya sabi ko, this is the most meaningful, the most meaningful Earth Day, and I have lived through at least 35, celebrated 40, at least 35, almost from the very beginning pala, kasi 72 yung Earth Day, diba? 82, 92, 2002, yeah, 40 years after this year, diba? Or something like that. So almost all, every year I have celebrated Earth Day, and it has always been a protest rather than a celebration, diba? And this year is nothing. Of course, it's still a protest, but actually, it's the most meaningful because it's what the pandemic has validated, what we have been saying all along. Lahat tayo sa CEC, I've worked with CEC for almost 30 years already. I mean, lahat tayo, regardless of the, di ba, our starting point in the environment, lahat tayo, lahat pinagsasabi na natin yan, na human well-being, welfare, our prosperity will be affected by what we do with the environment. And given that the cause of pandemics are environmental in nature, then it's very clear kung ano yung dapat lesson na makuha natin dito, anong kailangan natin gawin in the future, which is to be very strict about the environment, not to compromise on anything, di ba? I will be the first to admit na I've been in this area for a long, long time. I have been in government, I have been in academe, I've worked internationally, I've worked nationally, I've worked as a lawyer, I've worked as an academe, I've worked with business, di ba? I will be the first to admit na minsan pag mahirap na talaga, I will accept the next best thing. Di ba? As a parang, well, that's I don't know, I always pride myself na I always start to push for the most progressive outcome possible. But I will be the first to admit na whether it's climate change or biodiversity, I've negotiated for the country in this, di ba? Na pag hanggang doon na lang talagang mapupush, di hanggang doon na lang, di ba? And what is clear to me is hindi pwede na yon. Hindi na pwede yon. And we now have, very importantly, we now have the proof for that. That if we do not, diba, if we do not do things right by the environment, everything we work for in terms of economic development, in terms of poverty alleviation, in terms of overall well-being, all of that is going to be threatened because we did do things right by the environment. So, anong net effect nito? Stricter laws, going back to the drawing book, and make the laws stricter, absolutely not allow for trade-offs. Kasi yan ang pinaka-basic tool ng environmental policymakers, trade-off. Diba? Cost-benefit. Okay? In my view, tatanggalin na natin dapat yan sa equation when it means loss of biodiversity. When it means the risk of environmental damage that causes societal damage, economic damage, public health impacts is strong, di ba? Wala nang cost-benefit analysis, wala nang trade-off, you just don't allow it to happen. Di ba? That's very different from, well, di ba, papayag tayo ng konting risk, di ba? Kasi kailangan natin as a society, this activity, we cannot do that when the effect is a pandemic like this. So, sa akin, a pandemic analysis has to be incorporated in every single environmental impact assessment. As also a climate change analysis. And I want to relate the two here together, di ba? Ang difference, alam mo, I have been teaching climate change also for almost 30 years na rin siya. And generations na rin siya of students that I have taught it to. And one of the biggest issues always been my uncertainty dahil we use models, di ba? Sa climate change kasi, because we're talking about its impact 10 years, 20 years, 50 years, 100 years from now, we use models. If anything, what the pandemic has done is validate modeling as a way of garnering evidence in policy making. Itong lahat ng mga ginagawa natin, yung social distancing, ginagawa natin ito because of modeling, di ba? Because the models tell us, if we don't do anything, you will have 100,000 deaths and 1 million deaths and 500,000 deaths and 1 million hospitalizations, di ba? But here you see the importance of models. Yung models allow you to actually change the outcome, di ba? because of social distancing, siguro ngayon kung hindi tayo nag-quarantine, baka meron na tayong mga 100,000, 200,000 confirmed, even with minimal testing, di ba? Or marami ng infected. But I think we can be very much sure, Katrina, at yung audience dito, na with our enhanced community quarantine, di ba? Na na-lessen ang spread ng infection. Sure tayo niyan, di ba? And that's without the model told us na pag hindi natin ginawa ito ang resulta. Pag ginawa natin, hindi siya mangyayari. It's not because the model is wrong. It's because we did something about it. Di ba? About the prediction. Ganon din sa climate change. Ang difference ng climate change at a biological pandemic is a pandemic like this can turn out to be universal. And at the same time, with very lead time, di ba? 1 week. And differences between one country to another is 1, 2 weeks, 1 month. Di ba? Yung climate change, so far, has been very localized. Di ba? The impact is atmospheric, but the results are localized. Specific typhoons destroying specific islands, specific regions like in Yolanda, specific places, causing certain sicknesses, etc., etc. Okay? And that's why we have not, and ito sa misa parang naiinggit ako sa pandemic kasi nabigyan ng attention finally, di ba? Ang problema. While yung climate change, taon-taon, 3 decades ko na yan dinidikdik sa mga ulo ng mga policy makers at lahat. Pero ang hirap talaga until may bagyo, di ba? Until may bagyo, until may mawawasak, then your president cares about climate change. But only for the time na nagbagyo o may immediate impact. After that, makalimutan na naman. Di ba? Because it happens separately. Even in the Philippines, climate change is felt unequally at different times, at different place, and different years. Di ba? That's why it's harder. But let me point it out that there are also areas of climate change that can be universal at some point. Disease, for example, disease control, or the spread of disease, especially mosquito vector borne diseases, will be increasing because of climate change. That can also cause pandemics for you, for all of us, di ba? And of course, climate change can amplify the impacts of pandemics. Imagine lang kung babagyo tayo, di ba? In June, July, August, and then we're still in the middle of all of this, and we will be in the middle of all of this in June, July, August. Anong ibig sabihin niya? So, anong point ko? We also have to be more serious now about climate change after this. No? So biological and biodiversity is very important. So hindi na maulit yung pandemics. Host tayo ng maraming viruses na unique to us kasi unique ang biodiversity natin. Stricter on climate change kasi it exacerbates pandemics and causes their own pandemics. Very strict sa air pollution and water pollution. Bakit? They say na in Italy, for example, and in New York, a lot of the fatalities are because also it's very polluted. Strict sa water pollution because water can also carry the virus far. I mean, not as of course in a virus that is mas touching talaga siya. So I don't want to but as a precaution, kung napansin nyo, lahat ng mga swimming pools, mga beaches, sinasara din siya kasi because of pollution that could be polluted also with contaminated with the virus, no? So the overall impact of all of this actually should be all of us, including business, more serious with compliance with environmental law and making our laws stricter. So in the next pandemic, we can deal with it better, or better still, we can avoid the next pandemic. Yun lang po.
Thank you so much, Sir Tony. We're actually consolidating questions from everyone who's participated in the Zoom group chat, but also the ones who have commented on the YouTube live page. And I think we'd like to start with this one because this is also immediately what's on our mind. What would be the consequences if the lockdown gets lifted on April 30? And do you think it's necessary to extend it to May 15? Or as you said earlier, parang baka beyond May 15 pa?
Yung enhanced community quarantine, which is what we officially have now, I think can be lifted for some sectors
Okay.
where you can guarantee social distancing. If that sector is essential for livelihood and to deal with hunger, di ba? I think importante yan na kailangan gawin. I suspect that they will, but if you ask me if the question is will the government lift it, I suspect that it will not lift it. I suspect it will continue on for at least another 15 days. And hopefully, between now and May 15, you have more testing. And the testing will show na not that many already are infected. And therefore, it's safe to go out. But we still with social distancing, yung mga sinabi ko pa rin, di ba? Ang kailangan talaga natin i-work on na makapagtrabaho ulit yung mga tao, yung mga tao na hindi pwede magtrabaho sa bahay, makatrabaho ulit sila, at yung mga goods mapasok at ma-deliver ng tama. Di ba? Yung dalawang yun na kailangan natin gawin. Kasi until you do that, it is the responsibility of government with the help of all of us to feed each other. Di ba? Importante yan.
Yes.
So kailangan that has to come together. If the government says no lifting yet, government should give additional income, di ba? Additional income, and government should provide food with the support of the private sector. Given na yan. Actually, marami sa private sector naman so far has but alam natin may limit yan, both the government resources and private sector's resources have limits. And I'm not in favor, by the way, sabihin ko lang ito, I'm not in favor of the government selling properties to deal with this problem, di ba? Because this problem will happen again by the time wala ka ng di ba? That's so madrama yon pero hindi siya helpful sa tingin ko. They just have to find a way to deal with this. I would say, di ba, either the debt issue, baka sa debt natin pwede siyang either debt moratorium on debts or concessional funding, di ba? Wag yung commercial debt. But kailangan gawin yon. Without that, sa tingin ko walang choice yung government to open up, because then how can you feed people? How can people survive? But assuming magagawa yun ng gobyerno and do it much better than they're able to do that now, baka sabay May 15 you have more results and it gives you confidence to reopen, di ba? But having said that, ang rule pa rin is you only reopen essential. You still do social distancing. And those who cannot do social distancing, the business model has to change. Schools, churches, diba? Tourism, they have to change. I mean, for tourism, honestly, I don't have any idea how they can, in the meantime, do it. And it's probably the least priority right now. Except the people that depend on tourism will be seriously affected. I mean, yun. And then after May 15, pag mag-reopen na, it will be the new normal that I described. No? It will never be the old normal again. And I hope actually that it will not be the old normal, certainly for environment, And also for equity, no? I mean, sa akin, very clear dito, di ba? Now we have to fix our social system, di ba? Our social, economic inequality, our social safety nets. We have to fix that. This is not right. What is happening with respect to the poor.
I think I'd like to lead to the next question in relation to inequity. No, there's two questions that we have in relation to our indigenous peoples in the time of this pandemic. One asks about your assessment of the effectivity of government response with respect to the countryside and our indigenous peoples. The other actually already talks about the future that you mapped out for us and wonders about whether not allowing trade-offs would affect would severely impact the livelihoods that are dependent on ecosystem services, which is mostly poor rural communities and indigenous peoples as well.
Yes. That's a good point. I mean, so that's why in all of this, I've always, including in climate change even before this, ang palagi kong ini-stress the importance of a just transition. Diba? You can identify the right policies from an environmental point of view, even from a long-term point of view, but it doesn't help if you do not make sure that the people most affected by it has a just transition. Workers, indigenous peoples, local communities, yun ang priority mo in making sure that they have a just transition. Now, sa current situation, I think ang malaking challenge sa indigenous peoples are hunger in places that are no longer dependent on their own produce, or for IPs that have migrated nearer to cities. No? I'm helping one actually group deal with that challenge. So I think in general, I think yun ang kulang sa rural areas. No? As you know, the agriculture sector was already challenged dahil sa rice tariffication. If it is not done properly at this time, we will even have a rice crisis because of that. Kasi baka hindi na natin maasahan yung Vietnam, yung Thailand for cheap rice because alam ko they are also prioritizing themselves. No? Now, of course, this is also an opportunity for indigenous peoples to claim the narrative. Claim the narrative that their way of managing biological resources has always been more effective, better than the modern way of managing these resources. Because in all of these debates always, diba, we've always said that indigenous peoples have a superior way of managing these resources, of making sure that the resources are preserved and not destroyed. And that's why I go back to the question kanina of yung trade-offs, no? Yes, I know na indigenous peoples have also had to make trade-offs, but by and large, yung trade-offs ng indigenous peoples is much less burdensome than the trade-offs of mining companies or trade-offs of logging companies, because of the sustainable way that they harvest things. No? So ang kailangan natin gawin is to support those sustainable ways. No? And in fact, push back even on indigenous peoples who want to do things that, diba, that commercial in nature, that actually will cause the same problems that commercial users do, diba? You know, it doesn't mean that if they're indigenous people that they'll always be right. No? Ang point ko lang is a trade-off perspective. When the risk is that of a pandemic, remember yan ang sinasabi ko, I'm not saying that no trade-offs at all or no cost benefit at all. I'm saying if the trade-off or if the cost is a pandemic or climate change, which are equivalent to a pandemic, then your answer should be there should be no trade-off.
Okay.
Ganun kasimple siya.
Thank you, Sir Tony. Parang there's something wrong with your mic.
Okay.
Or there, now it's better. It was there was a sound at certain points.
Okay, sorry.
But now you're clear na ulit. I think we're going to have a live question from someone who's in our Zoom group chat. This is from, we're going to unmute Paolo Pagaduan from WWF. Paolo?
Yes, can you hear me?
Yes, we
I can.
Hi din, Tony.
Hi,
With
Carlo.
regards to yung risks natin sa governance, kanina earlier you mentioned about how burdensome bureaucracy can get, di ba? You mentioned yung DSWD permit. Pero are you saying that we should sort of sweep this under the rug for the moment? Pero won't we be charged later on? Kasi I remember it's very hard to secure that DSWD permit. But everybody's raising funds now and it's helping a lot of people, and yet we know it's illegal. So DSWD has not yet been clear about the memorandum, if it's suspended or not. They just removed the post, but they didn't answer it. So can we do that for now because of the crisis?
Well, that's why I actually in my article I actually suggested ways of to be safe, not to deal with it, diba? So for example, if you are, what's really covered there, diba, is like general public solicitation, diba? In fact, ang talagang tinutukoy dyan, newspapers, ganun. Kasi that was really the intent of that law. The positive part, there's also a negative part which is to control that, but also the positive part there was to prevent fraud, diba? Yung mga tao na mag-solicit for causes that are not legitimate. No? So sa akin, if you really want to be safe about it, then your calls should be directed to very specific audiences, to very specific people, okay, and not a general call. Should be directed to, for example, for ordinary people who are soliciting for their hospital, their town, their solicit it to your townmate, solicit it to your family, solicit it to your friends. I mean, direct it, even if it's public, like in Facebook or things like that. That's actually enough. You just say to all friends, please, to all my friends, please. That's. I think you're not covered by that anymore. I think organizations, let's also be clear, organizations that are allowed to actually, by their charters, accept donations, solicits that are not, have never been covered about this. We probably got the permit to be safe, but we were never really covered by this rule. No, of course, I'm waiting. Hopefully, the DSWD would put in something more rational about this. For me, it's not, most likely they will not be filing cases about this. It's really just more, I can't advocate violation of law. No, that's not my role as a law professor and as a lawyer. My role more is to facilitate an interpretation of law that allows people to do the right thing. It's the same thing with hospitals. I mean, the rule, the administrative order is also very clear that you're supposed to give first to OCD, who will then distribute it to the right hospital. But I don't think that's people are also following that. I think people are just giving to public hospitals as they deem fit, and hospitals are actually accepting them as well. No, so for solicitation, I hope that the DSW would come up with some kind of either rule or simplified sort of documentation about this. But in the meantime, I would suggest that the kind of guidelines I did out. By the way, it doesn't apply for sure to goods, to in kind. This is only for cash donations, no, the solicitation. That's very clear under the presidential decree.
Thank you, Sir Tony. I think we're wrapping up through this last question. And maybe we're asking you this primarily as a citizen, which I feel is what we all are at this point, given this pandemic, which is why nga, parang instead of even getting bogged down by the bureaucratic processes, we've all just decided to do what we can. Because we are getting the requests from hospitals mismo and from communities in need. And obviously, we get those requests precisely because there are gaps in government response. So parang kung kaya mong tumulong, bakit ka pa maghihintay ng permit at ng pasabi sa kung ano mang government agency, no? And I think as citizens, we're all also now finally grappling with the magnitude of this pandemic, 5 weeks into the lockdown, and the magnitude of having a government like this one 4 years in. So maybe it is the most appropriate question to end with. How would you rate or assess the government response on COVID-19? Do you think that President Duterte's leadership, the way he conducts himself, has been effective in terms of leading us and guiding us in this time of crisis?
And the short answer is no. And that's unfortunate. It's because of his style, and it's because of the way he has governed this country, which is the political style has always been to divide, because of the idea that division is the one that gives you a political advantage over your real or imagined enemies. This is not a time of division. I think the president himself would have said that, would admit that. And so what I would have liked to hear from him, diba, is a call for unity, a call for inclusiveness, no scolding of people, no threatening of people, because those are the kind of things that actually divide people. What we need is unity at this time. What we need is social cohesion at this time, and that the lesson of all of that in history is you can never coerce that. You cannot coerce cooperation from people. You cannot coerce people to do the right thing, and then that the best way forward is always to appeal to people's patriotism and people's sense of generosity and goodness. I don't want to end in a negative way, because I also think that in spite of that, there's been quite an amazing expression of generosity among the Filipino people. Diba? I talked about the business sector. I talked about activist groups, for example, that are doing good things with their constituencies. I support. I'm familiar with what Kabataan does, and also what BMP, a labor sectoral group, does, because one of my family members is active there, and I'm very impressed that that they get it, that they don't politicize this, that they don't see this as a a chance to push an agenda,
but actually just to make a difference for our people. I mean, and I've seen that in local governments consistently, in some national government officials, as I mentioned, Carlo Nograles is one of those. So hindi naman siya unidimensional. But it would have helped if we had a president that encouraged that behavior. I mean, in fairness, I think he also has some ability to do that. That's why it is very natural for him to just fire the person that says Lenny Robredo has to be investigated for doing the right thing. I mean, that was one rare moment that I thought that the president was clearly non-partisan and just simply looked at the interests of the country. I'd like to have more moments like that.
We would all like to have more moments like that, I think, at this point in time. Thank you so much, Dean Tony Lavinia, for staying with us the past 2 hours and answering our questions. We'd also like to, I think, encourage everyone to continue having this discussion. We're going to consolidate all your questions, the ones we weren't able to ask, and send them on to Dean Tony as well, and then figure out a way of making all of his answers accessible to everyone. To do a synthesis on our talk today, we're going to have Enteng Bautista, who is the International Network Coordinator of Kalikasan PNE. Enteng.
Yeah, magandang tanghali at makalikasong pagbati sa lahat. Muli, maraming salamat kay Dean Tony Lavinia for giving his time and knowledge dito sa ating talakayan. Laging maasahan si Dean Tony para sa kapakanan ng ating kalikasan at sa interes at karapatan ng ating mamamayan. Congratulations din sa mga organizers, sa Center for Environmental Concerns, sa staff ng Kalikasan People's Network for the Environment. At syempre sa iyo, Katrina, sa mahusay na pagpapadaloy ng ating webinar, ng ating talakayan. Meaningful Earth Day, no? Makabuluhan yung pagpapagunita natin ng araw ng kalikasan sa April 22 na to, at isang pamamaraan nito doon sa ating forum na risk and governance in time of COVID-19. Marami tayong natutunan, no? Bagamat sinabi kanina na kulang, yung may mga nakita tayong mga tama na ginawa ng mga gobyerno na binanggit ni Dean, yung mass testing ng South Korea, yung mass education na ginawa ng Vietnam at ng Taiwan, pati na yung mass mobilization, yung maagat na lockdown o quarantine ng New Zealand. At syempre, yung pinakita rin sa atin yung pagkakaisa, yung pandaigdigang pagkakaisa at mahusay na sistemang pangkalusugan ng ginawa rin ng Cuba. Dito at malinaw rin yung assessment ni kanina na nababanggit na kulang yung naging maagap sana yung pagtugon ng gobyerno doon sa epidemya. Ganun pa man, yung mga matatampok na nabanggit na malaking kakulangan, sana maayos pa ng gobyerno. Yung unang-una, yung konsiderasyon sa mga kababayan natin sa mga susunod na hakbang, kung ano man to, no? Sosyal, polisiya, ekonomiya, partikular dun sa mga batayang sektor tulad ng mga magsasaka, urban poor communities, yung mga kapatid nating katutubo, at syempre yung mga profesional, lalo na dun sa lower middle income earners natin, no? Nabanggit din doon yung isa rin kung bakit mabilis at medyo nahihirapan tayong sugpuin yung ating itong epidemyang ito ay yung na inabutan natin medyo mahina na talaga yung ating healthcare system, no? Nabanggit na yan yung kanina nga na pangunahing na nasa panganib ay yung ating mga frontliners, yung ating mga medical professionals. At syempre yung kakulangan din ng mga pasilidad. Pangatlo, nabanggit din kanina, yung siyempre kung maaga at epektibo, yung pagiging burocratic, no? Burokrasya ng tugon ng gobyerno. Nakita na natin yan sa una, yung sinasabing sapat yung pondo, maraming pondo, pero nahihirapan yung mga local government units na makuha itong pondong ito. At yung pangapat, dito masyado tayong halos lahat, no, ay lahat ay naapektuhan. Yung pagiging militaristic o repressive approach ng government kung paano immediate at tugunan itong epidemya. Hindi naman tayo tumututol dun sa mobilization ng pulis, ng militar, kung ang gagawin nila ay maglilinis, magbibigay ng edukasyon sa mga mamamayan, magtatanim ng mga puno, sino ba ang tatanggi doon? Pero kapag nakikita natin na nalilimitahan yung karapatan, hindi lang nalilimitahan, nalalabag pa yung mga batayang karapatan at demokratikong karapatan ng mga mamayan, tulad ng nabanggit kanina, hindi nakakatulong ito, kundi mas nakakapag naglalagay pa sa panganib, no? Hindi lang nung mga nilalabag na yung mga na-violate, no? Yung sector na ba-violate ng mga rights katulad ng mga magsasaka, kundi yung buong populasyon. So hopefully ma-address to. At dito sa bandang uli, nakita rin natin na yung medyo may kakulangan doon sa liderato ng kasalukuyang administrasyon para tugunan. Pero ang importante yung paano tayo mag-move forward, no? Paano natin dapat harapin pa at bilang mga ordinaryo ano yung mga pwede pa nating gawin, no? Binanggit kanina ni Doc Dean Lavinia na una hindi na sa pagkakasunod, no? Yung pagtindig natin na anuman yung solusyon ng gobyerno ay dapat i-uphold niya yung democratic and basic human rights ng mga mamamayan. Kung hindi sana magdeklara ng martial law at walang dahilan para magdeklara ng martial law. Nasa atin yun din yun para tutulan to. Pangalawa, dapat maging epektibo at mas dumami pa yung tulong ng gobyerno, economic relief sa ating mga mamayan. Hindi lang sa pagkain, kundi yung pangkabuhayan din. No? At yung serbisyo tulad ng transportasyon, medical ay maparami pa, di ba? May mass testing pero dito sa southern buong Calabarzon, kung nasaan ako ngayon, ang aming mass testing center ay nasa Alabang sa buong region, no? Isa sa pinakamalaki, ito yata ang pinakamalaking region outside Metro Manila. So dapat paramihin pa, dapat igiit natin na paramihin pa yung mga ganitong serbisyo ng gobyerno. Siyempre, kailangan tulong din sa ekonomiya at sa ating mga maliliit na mga negosyante. At isang klaro doon, no, imbis na mangutang at nangutang na nga, ay yung tinatawag nating wag muna tayo magbayad ng utang, no? 1 trilyong piso ang binabayad natin taon-taon sa ating utang, dayuhan at pribadong utang. Kaysa umutang ng bago, pwede nating bawasan yung pagbabayad natin, no? Para magamit natin sa public facilities and services. Gayun din sana ay tulad ng nabanggit yung pagbabago ng mga pulisiya ng gobyerno sa immediate, dapat mas nag-i-encourage ng volunteerism, collective action sa hindi lang sa mga local government units kundi doon sa mga people's organizations natin at tumulong paano ma-address ng epidemya. Siyempre, kung sa pangmatagalan, yung mga policies natin, lalo na sa usapin ng pangkalikasan, immediately po sana, no, tulad ng nakita natin sa Humonhon, pinatuloy pa yung mining dito sa Nueva Vizcaya, inalis pa yung barikada para hindi magpatuloy. Isang konkreto po yung yung pagpapabasura at pagbabago ng batas sa pagmimina. Pero tulad nung sinabi ni Dean Lavinia kanina, mahusay po para mas epektibo, maharap natin, mabawasan natin yung epekto ng mga susunod pang mga outbreaks, epidemics o pandemics man yan, ay dapat nating baguhin o pausahin pa yung pang-ekonomiya at social na sistema na nasa atin ngayon. At siyempre, isang requirement dyan ay yung pagkakaroon ng isang makatao, patriotiko at progresibong liderato ng bansa o leadership. Magandang umaga po sa inyong lahat.
Okay, magandang araw po sa ating lahat. Maraming salamat po sa pagsubaybay sa ating ikalawang seminar. At i-remind po namin ulit, the next webinar would be on Earth Day itself, April 22, same time, same place, sa inyong kanya-kanyang mga rooms. Kita-kits po ulit tayo. Maraming salamat sa mga nakinig, and we will make sure the questions that you aired that were left unanswered will be addressed later on. Maraming salamat po sa lahat at mabuhay tayong lahat.
Maraming salamat. Bye-bye.